Good morning. My name is Ed Flynn. I'm the chair of the Boston City Council Committee on Veterans, Military Families. Today is March 20th, a little after 10 a.m. This hearing is being recorded. It is also being live streamed at boston.gov/citycouncil-tv and broadcast on Xfinity Channel 8, RCN Channel 82 FiOS, Channel 964. Written comments may be sent to the committee email at ccc.vma@boston.gov and will be made part of the record and available to all councilors. Public testimony will be taken at the end of the hearing. Individuals will be called on in the order which they are signed up and will have an opportunity to testify. If you are interested in testifying, please add your name to the sign-up sheet near the entrance of this chamber. If you are looking to sign up, testify virtually, please email City Council Staff Liaison Shane Pack at Shane, S-H-A-N-E, .pack at boston.gov for the link. Your name will be added to the list. Today's hearing is on several dockets, and I'll read the first one, docket 0166. It's an order for hearing to discuss services for women veterans. This matter was sponsored by Councilor Flynn, referred to the committee on January 8th. The second docket, 0255, order for a hearing to discuss new cancer presumptions announced by the U.S. Department of Veterans Affairs. Matter was sponsored by Councilor Flynn, referred to the committee on January 15th. Docket 0320, order for hearing to discuss the lung cancer rates among Black veterans. This matter was sponsored by Councilor Flynn and Councilor Tanya Fernandez-Anderson and referred to the committee on January 29, 2025. I am joined today by colleagues in order of arrival: City Council President Rutzi Louis-Jean. I will also give an opening statement. I also want to give opportunity for my council colleagues to give an opening statement, and obviously the people testifying today, which includes Rob Santiago, who is the Commissioner, Office of Veterans Services, City of Boston. Thank you for being here, Rob. And I also have Dr. Renda Wiener, Principal Investigator, Center for Health Optimization Implementation Research at the VA Medical Facility here in Boston. Commissioner and Doctor, thank you. It's good to be with you. Thank you for being here. I'd also like to recognize Councilor Murphy and Councilor Fernandez-Anderson. I did not mention Councilor Murphy, but she did. She was a co-sponsor on one of these dockets with me. Today we'll discuss three topics: services for women veterans, new cancer presumptions that were announced by the VA earlier this year, lung cancer rates among Black veterans. as I mentioned, for the order of operations, we'll start with the first docket on services for women veterans, take questions, then move on to cancer presumption. We'll take questions, and then discuss lung cancer rates among black veterans as well. As a city councilor and U.S. Navy veteran for 24 years, ensuring that our veterans have access to health benefits, services, outreach, and employment programs are critical. Some stats on the 3 dockets. Women veterans are the fastest growing population at the VA, comprising almost 70% of all new Veterans Health Administration patients, 300,000 patients, veterans. 300,000 veterans are at the reproductive age as well. Since the signing of the PACT Act in 2022, over 3.5 million service members and veterans who are exposed to burn pits, Agent Orange, other toxins while serving overseas are eligible for free benefits. Veterans have a 25 to 75% higher risk of lung cancer and asbestos exposures, remaining a significant contributor to this elevated risk. As the number of veterans accessing VA health grows, it is important to learn more about the programs, support services, care, communication, and outreach opportunities that there are, so that we can continue to support our veterans. In light of federal cuts to the VA, I also want to discuss whether some of these essential programs and services that we work on may or may not be impacted. Commissioner Santiago, I was with you recently at the VA medical facility in West Roxbury with Congressman Lynch and veterans and with employees of the medical facilities protesting the cuts to the VA medical centers. Thank you for being there, Commissioner Santiago. Thank you for the work you're doing. We must recognize the challenges that our veterans face when returning home and continue to advocate for services that they need for their health and their well-being, and to support their families as well. When a veteran serves, so doesn't the family, so doesn't the spouse. They also sacrifice, and the children. Our veterans serve our country with honor, valor, distinction, and when we send a veteran into harm's way, I believe we have a moral obligation to care for them when they return. I look forward to hearing from Commissioner Santiago, the Deputy Commissioner as well, the Commander of the Carter Post, Commander Tewitt, Dr. Weiner from the VA Medical Facility on your insights today. At this time, I'm going to go to opening statement from my colleagues, and then I'm going to go to you, Doctor, and to the Commissioner with opening statements. But at this time, City Council President Louis Jean, you have the floor.
Thank you very much, Mr. Chair, and thank you for your leadership on this issue and on other issues here on the Council. It is incredibly important. I want to thank the Commissioner. The Mayor often says the best Veteran Services Commissioner in the country, so thank you so much for all you do. I know that there was an important event last night where a lot of these issues were discussed, and I look forward to hearing more about them. Doctor, thank you for being here and for the work that you do. I was in my car this morning listening to NPR and was hearing about the cuts to the VA, and even if our veterans don't feel it at the very moment, there is that fear and that sense of what could be coming down the line. So I just want to thank you and all of our veterans, especially our disabled veterans, for the work that they have done and for the sacrifices that they've made for this country. And that's why it's all the more incumbent that we make sure that the VA and all of our services are addressing the needs of our veterans, particularly those who are disabled, who have other forms of marginalization, such as they're Black or brown or they're a woman, which is why the work of diversity, equity, and inclusion in every corporate space, in every government space, in every school is incredibly important, because it's about correcting for past harms and making everyone feel included, right? People who are serving this country with honor, valor, whether they're of perfect physical ability or have a disability, whether they're straight or queer, whether they're black or white, that when they come home, they get that sense of honor. And we do a disservice when we're not treating people who have cancer or treating people who come home with PTSD. So I look forward to hearing and learning from all of you and to learning how the council can lean in more into this work. So thank you very much for being here, and thank you, Councilor Flynn.
Thank you, Council President. At this time, I would like to ask Commissioner Santiago, would you like to give an opening statement?
Thank you, Chair. Yes, I would. And this opening statement, it pretty much going to be the blanket opening statement for all the dockets this evening, because I think it is very important for us to discuss this and to let all veterans there in the city of Boston and beyond, whoever's listening, know that we're here for them. So today I wanted to take a moment to reflect on the vital partnership that is essential to the health and well-being of our veteran community. The collaboration between the City of Boston Veteran Services and the Boston VA healthcare system. This is also very personal for me. As you've mentioned, Councilor Flynn, I'm a retired Navy veteran myself. So our partnership is a testament to our deep commitment to those who have bravely served our country, often also at great personal sacrifice. Veterans are the heart and soul of our nation's freedom, and their needs are varied and complex, requiring a compassionate and supportive network. While the Boston VA healthcare system provides outstanding medical care, it is also very crucial that they are not alone in this mission. This is where our city services play a crucial and irreplaceable role. We understand that veterans face a multitude of challenges that require a comprehensive approach, from support with housing to financial assistance to transportation and emotional well-being. We strive to complement the VA's medical services by creating a holistic safety net for every veteran. We know that emotional and mental well-being is just as important as physical health. Through our collaboration with the Boston VA, we are dedicated to expanding access to mental health services, crisis intervention, and substance abuse use treatment. These efforts aim to address the often unseen struggles many veterans face, reinforcing a safety net to ensure that no one falls through those proverbial cracks. Our partnership with the Boston VA is a powerful reminder of how local and federal resources can unite to support our shared mission. By aligning our priorities, whether it's preventing homelessness or providing specialized health services for women and black veterans, we are maximizing our impact and ensuring that veterans have a seamless experience as they navigate the system. As we look ahead, let us remember that caring for our veterans is once again a collective responsibility, a heartfelt partnership rooted in respect, gratitude, and duty. The City of Boston is steadfast in supporting our veterans, as is with the Boston VA healthcare system. Together we can provide the care and opportunities our veterans greatly deserved. And to every veteran who calls the City of Boston home, please know that you are not alone. Your city, the staff at the VA Boston healthcare system, and your entire community stand united in supporting you. Thank you for your service, and a heartfelt thank you to our partners at the Boston VA for your dedication in our shared mission. Let us continue to honor and serve those who have selflessly served us. Thank you, sir.
And thank you, Commissioner, and thank you for your service to our nation, but also for your commitment to our veterans and military families, not just here in Boston, but across the country as well. Dr. Rendawina, you're up if you'd like to give an opening statement.
Okay. This is on, right?
Yeah, it's on.
Okay.
Yeah.
Good morning, everyone. Thank you to the chair and to the council for the opportunity to participate today in this important hearing. And I want to also thank any veterans who are here or who are listening for your service to the country. My name is Renda Wiener. I'm a pulmonary physician and a researcher at the VA Boston Healthcare System. And it's been my great honor and privilege to take care of veterans with lung conditions for more than 20 years, and also to engage in research to try to improve VA care and veteran outcomes. I'm a professor of medicine at the Boston University Chobanian and Avedisian School of Medicine, the associate director of the VA Boston Center for Health Optimization and Implementation Research, also called CHOIR, and the Deputy Chief Consultant of the National Center for Lung Cancer Screening for the Veterans Health Administration. I'm also the principal investigator and lead of the VetPeer Connect study, which I'll discuss later, and was invited to participate today to provide testimony about the critical issue of lung cancer among veterans and among Black veterans in particular who are at higher risk. I do need to just disclose that I'm speaking today as an individual citizen. Despite my roles in the VA, the perspectives that I'll share are my own views and do not necessarily represent those of the Department of Veterans Affairs or the U.S. government. Thank you.
And thank you, Doctor. It's good to be with you, and thank you for the work you're doing. We appreciate that, and we had the opportunity to attend the event, public awareness event at the Kroc Center in Roxbury, where you did you and your team did a wonderful presentation to veterans, Black veterans and their families about this critical issue. So it was a very informative topic, and just want to say thank you.
Thank you.
I'm going to, so the first order, 0166, it'll be focused on women veterans. That's where our questions will be geared toward at this docket. I'm going to give my council colleague the first opportunity to ask questions on this docket, and then I will ask questions after, and then I will open it up to any public testimony or virtual testimony, and then at that point, we'll go on to the next docket. But at this time, Council President, would you like to start with opening questions on the first docket, which is a discussion on women veterans?
Yes, thank you, Mr. Chair. Commissioner, my question, I guess, is a general question, and I know that your office, you know that there were a number of events last year to highlight the needs of our women's veterans. If you had to identify sort of what are the biggest gaps in services for our women veterans, and also to you, Doctor, what would the biggest one or two issues be for women veterans specifically that's different from issues that male veterans face when it comes to receiving services?
I believe IVF is one of them, but also, in general, getting the access to healthcare is huge within the women veterans community. I know we're lucky here in the Boston VA that there is a women's clinic that the women veterans could go to access those critical healthcare needs that they have here in the Boston area. But I would also like to see if you have anything to add to that as well.
Yeah, I would echo what you said about reproductive health services and are very important. And also just in general, being able to access care in a way that feels comfortable and safe is critically important for women veterans.
Thank you. I have another question. Oftentimes, there are veterans organizations or veterans events that occur. And I wonder, given that women veterans have a shorter legacy in serving in any branch of the armed forces, how are they integrated into the veteran community itself, or how are they able to participate in sort of the leadership of veterans issues here in the city of Boston? Do you see that as a challenge because of, comparatively the recency of their involvement in services?
I'm proud to say that here in the city of Boston, because we are such a welcoming city, that our women veterans are very well integrated to the veterans inside of the veterans community in our ecosystem. We have a lot of women veterans that are leaders within the veterans community. One in particular is Meredith Tewitt, who's the commander of the William E. Carter Post, one of the most prestigious American Legion posts in the country. She leads the way with regards to that. She's also the District 7 commander for the American Legion here as well. We've had women leaders within the VFW as well. Christine Tron, who's also going to be the junior vice commander this year for the state VFW. Our women veterans, while there's always needs for improvement, and I'm not going to deny that, but I like to think that right now, within our ecosystem here in the city of Boston, that they're very much a part of that conversation. Last night, we had our Women Veterans Roundtable, where we had a panel of just amazing speakers, to include Meredith, to include Master Chief Rashawn Morris, to include Liana as well, and Jessica Frost, who's the director of the Women's Initiative in the Executive Office of Veteran Services. So while there's always room for improvement, I think that we are in the right direction. But I have to say that what we heard last night and listening to their stories and the stories of women veterans and how far they've gone and how far they still need to go is very empowering. Just to listen to them, to hear what they have to say, what their experiences are. That's what we all need to listen to. And I will preface with our event last night. The panel was incomplete. We had an incomplete panel. We had 4 veterans. Whenever we have a women's roundtable, we've always had active duty service members as well as veterans. Last night, we didn't have the active duty component of our women veterans roundtable because of the executive order that was handed out. So to me, it's even more important now that these women veterans speak up, especially for those active duty service members that unfortunately are unable to speak up at the type of events that we had last night. And I think that with our women veterans here in the city of Boston, we're well represented and their voices will be heard. And I am behind them 1,000% in leading that charge.
Thank you, Commissioner. I'm appalled, and thank you for the work. I am saddened for people who do not realize that creating space for everyone, for people who have often been ignored, leads to all of our success, and that it's not a zero-sum game, and that when we lift up those who are the most marginalized, we work for the benefit of this entire country. So thank you for your service. Thank you for that answer. I will take that response just as saying that if there's work that we need to do here, it's making sure that women veterans have access to health care, that we improve that ability to access health care, that we do everything we can, given the national regressive landscape, that we do everything we can to support our veterans and hopefully also find ways to support our active service members who are women as well. And I also just wanted to uplift, on veterans, for the Black Veterans Day brunch this year, you honored 6668, and I actually hadn't seen the Netflix movie before that, and that prompted me to go see the movie. And so I'm just very grateful for the work that you do in uplifting, right, not only women veterans, but Black women veterans, a doubly marginalized population of people who have sacrificed so much for this country, the 6668 being the first all-Black, all-women battalion in World War II. So thank you, Commissioner.
Thank you, Councilor.
Thank you, Mr. Chair. That's my questions on this docket.
Thank you, Madam President. So I'm going to ask a couple of questions before we go to the next docket. Women veterans, the fastest growing population at the VA medical facility. How are we preparing? How is the VA preparing, whether it's short-term and long-term, to ensure that women veterans get the support services, gender-specific medical care that they earned? How are we doing that? It could be for both of you guys.
I'll start. I think, again, outreach is definitely a big part of that. Also the fact that our VA healthcare system here in Boston, I may be a little partial to this, but I truly feel that we have the best VA healthcare system in the country. How are we preparing to take care of our women veterans is by letting them know that the VA Boston healthcare system here still maintains a presence in women's healthcare. Again, like I mentioned earlier, there's a clinic specific to just women veterans that we've had now for believe, about a number of years now. We've had a number of years now at the JP campus. And they keep doing the outreach. They keep taking care of our women veterans as best as they possibly can. You know, we hear everything that's coming out of DC right now and all these cuts. But I could tell you firsthand that one thing that I do know is that they're mission focused. That they're mission focused here at the Boston VA in ensuring that our women veterans are being taken care of. We could go into some specifics with those folks at the VA that actually run those programs. But, you know, I could tell you right now firsthand, in working with the VA, they've been very responsive to any of the needs that our women veterans have had, and has been very responsive to me whenever I needed to pick up the phone, send an email, a text, or even a phone call with the folks there at the VA. So the outreach part is a huge part, letting people know that the VA healthcare system, they're still mission focused and taking care of all our veterans, including our women veterans, and I think that's very important to communicate. And they are always there and have been very responsive. And I think, you know, I don't know if you have anything to add to that, but.
I think I would echo that. Women veterans are a priority for the VA in general, as well as for the Boston VA specifically. There are specific programs, women's health programs and clinics for this population, and also efforts to accommodate the needs and preferences of women who are seen in other clinics. Like, for example, I can speak from my experience as a pulmonologist. You know, there are some women veterans who have experienced, unfortunately, military sexual trauma or other issues, prefer to be seen by a female provider, and that's something that we always strive to accommodate to make sure that people feel comfortable and safe in getting the health care that they earned and deserve.
Thank you, Doctor, and thank you, Commissioner. Commissioner and Doctor, for a woman veteran that might be watching the program, that might not be engaged in the VA, they may have been engaged in the past and they kind of drifted apart and they didn't necessarily apply for the services, seek medical care at the VA. What can we tell them, or how can we encourage them, or listen to them really, about their challenges, struggles, and issues that they may have had with the VA? But is there anything that we can do as leaders where we can at least listen to them and maybe talk to them and hopefully give them another opportunity to seek medical care at the VA? Because even though they may have had a bad experience initially, doesn't necessarily mean they're going to have a bad experience again. But what are your thoughts about that?
I think for me, the first thing that any veteran should do, you know, in particular women veterans, is to contact whoever your local VSO is, your Veteran Services Officer. We are there to advocate for you. If you've had any you know, bad experiences, you know, at the VA, let us know. Or they also have offices at the VA where you could patient advocacy offices at the VA, that if you've had a bad experience, you could contact them, and they will also be able to take care of and elevate your issue with either your primary care or whichever department it is that you've had any problems with. But contacting your Veteran Services Officer, in this case here in Boston, is the Office of Veteran Services. We are going to be there to advocate for you and then see where we could go to ensure that the services that you have earned and deserve as a veteran are taken care of.
I would add that it's also just critically important to listen to women veterans, to Black veterans, as we did in the Vet Peer Connect study, and to other groups that, you know, may have needs that are different or specific that we can and should address. So, you know, just taking the approach of taking the time to hold space, to listen to the stories, the concerns, the needs, the preferences, and then create programs to make sure that we are addressing those in a way that is sensitive.
I think also, Counselor, if I may add, just to piggyback off what the doctor said, is also, you know, being involved in peer groups. You know, there are a lot of other women veterans out there that, you know, may have the same experiences, or could share certain stories as to what their experiences were at the VA. Again, I'll defer back to last night's event where we had our women veterans talk about their experiences, not just in the VA, but some of the things that they've been through in their time in service, and then just listening to what your fellow veteran has to say is also a great way to really help you get and be supportive in getting those access to the VA.
Well, thank you, Doctor, and thank you, Commissioner. The forum last night was excellent, and I especially enjoyed going to it because it's an opportunity to listen and to learn about their stories in their service, their sacrifice. Women veterans, as we know, have distinct challenges that male veterans may not have, and one of them is child care. A woman veteran that might be homeless, and I'm trying to work with Sheila Dillon's group, but trying to ensure that a lot of affordable units that we are somehow giving an opportunity to homeless veterans, especially women veterans, with an opportunity for housing. And part of that also would include services for the family, services for children especially. So that's an issue, that's a challenge that I'm going to continue working on. Before we go on to the next docket, is there anything you wanted to say?
I guess along the lines with this docket and the next two dockets, that I want to say is that's why, here in the city of Boston, and I'm sure in Massachusetts as well, we're going to continue the fight. We're going to continue to voice who we are as veterans because it needs to be heard. We all know, and we've said it here tonight, or this morning, I should say, not tonight, but we said it here today, that women veteran needs are different than male veteran needs. The same thing could be said about, LGBTQ plus veterans, black veterans, Latino veterans as well. So our voices here in the city of Boston, as far as I'm concerned, as veterans, will be heard, because if we don't speak out, if we don't talk about what we need to talk about and what our needs are as veterans, then we're not doing ourselves a service, and we're not doing the veteran to our left, the veteran to our right, in front of us and behind us a service as well. When one veteran thrives, we all thrive. When one veteran needs help, we all take care and have that veteran sticks to ensure that they're taken care of, because that's what we need to do as a community.
Thank you. And one final point before I go to the next docket. Rob, I don't know, maybe 7 years ago, 6 years ago, you and I worked on and discussed women veterans, male veterans, but LGBTQ plus veterans that were given discharges out of the military that were not honorable at that time, going back many years. You and I, especially you, really brought that issue to the forefront, even across the country, that veterans that were discharged because of their sexual orientation, that discharge paper would impact them their entire life. But what you decided, Commissioner, is to have a conversation across the country with VSOs and the VA as well, but to ensure that those should be upgraded. Those discharge papers should be upgraded, not from to an honorable discharge, so that veteran could get the same services, programs, support that we received. But a lot of veterans, because they were gay or lesbian, were discharged out of the military with a discharge paper that was not honorable. It was something other than honorable, and that means, as you know, that they were not entitled to 100% of the same benefits as say I was. But I know under the Biden administration and the Harris administration, they made great efforts to review those discharge papers for gay and lesbian veterans, trans veterans as well. But I do think, Commissioner Santiago, the conversation started here in Boston under your leadership. So I want to acknowledge that, Commissioner Santiago. I want to go on to docket 0255, in order for a hearing to discuss new cancer presumption announced by the Department of Veterans Affairs. I know, Commissioner, you gave a opening statement, kind of general on these topics, but do you want to, or Doctor, do you want to do a statement on this specific docket, or would you rather us go to questions?
I don't have a statement on this particular
Okay.
docket.
Yeah, I think it's very important to discuss this, and I thank you, Chair, for bringing yourself and the other councilors to bring this in the forefront here in the city of Boston, because it needs to be known that a lot of these presumptives are things that the VA are now also looking into. We've had veterans going as far back as the Vietnam or even World War II, for that matter, that a lot of their presumptive issues were not taken care of because the VA didn't recognize them, because the federal government didn't recognize them, whether it be Agent Orange, whether it be you're cleaning up nuclear waste in certain depots back in World War II. So I thank you again for bringing this up, and also the burn pits, just as early as the Desert Shield, Desert Storm, and also Iraq, Afghanistan. So thank you for bringing this and wanting to discuss this.
Can I just add?
Of course, of course.
Yes, I would say this is such an important issue, and this, as you mentioned, women veterans are a large growing population of veterans, but also people coming into the VA because of the PACT Act and because of these presumptive conditions. Huge influx of people, different needs that they have related to their pulmonary health, these cancers. And this is a very active area of research for the VA to try to understand what the health effects of the various toxic exposures are that veterans face during their military service. And, it's unfortunately a time where the VA is facing potential cuts, and I hope that doesn't go forward, because these are both medical care and research. It's so important to understand the impacts of these exposures and the cancers and other health problems that result from them.
Thank you, Doctor. I'm going to, before I go to the City Council President to ask questions on this docket, for the first docket on women veterans and for the second docket that we're going to discuss and ask questions, if a veteran is watching now, is there any contact information for them that you could help them with? Should they call your office directly, Rob, and you could help them navigate the VA system, or what is your recommendation?
Most definitely, they could contact our office. They could email us at boston.gov/veterans is the website that you could go into. We have updated and a live website that contains all that information. The state's HERO Act information is on there, as well as the federal PACT Act. And if I could just echo something from the doctor really quick about the PACT Act, it's just astounding to me that now with the signing of the PACT Act, and how comprehensive it is in taking care of our veterans, especially with these presumptive conditions now, that the Secretary of the VA and the federal government is actually thinking about cutting our VA and getting rid of those very vital services. And what I mean by services is also includes those veterans and care providers that work for the VA, getting rid of over 80,000 jobs that are going to affect our veterans. So the PACT Act, what that brought is, more services to our veterans, but now you're telling us that these jobs are going to be cut, which means also some of these services are going to be cut as well, and it's unfortunate to say that, and I say that as a veteran. But any veteran out there that wants more information about the PACT Act, wants information about how they can navigate the VA system, could definitely contact our office and give us a call in our office. I'll pass on that information towards the end as well with the contact information.
Perfect. I'm going to go to the City Council President.
Thank you very much, Councilor Flynn. Can I just ask generally about what the cancer presumptions are?
There's a whole list of them.
Okay.
Lung cancer is one of them, many other cancers.
And is it connected to service?
Yes.
Yes.
To exposures during service.
Okay.
If I'm correct, I believe there's a list that grew by 20 or so presumptives on there. It's a pretty
Many
extensive
conditions.
list. I'll make sure to get that list to you, Madam President.
And what does that change about their care?
It entitles them to receive VA benefits for those conditions.
Okay.
Yeah.
All right.
Then also, speaking of the care, you don't have to be registered as a VA patient to go and get the toxic exposure test also. So don't think if you're a veteran, because you don't get your care to the VA, that you don't have to go to the VA, or you can't go to the VA. If you want to get this toxic exposure test, you could get it done even though you're not getting your care to the VA. And they could also, through that process, maybe find something that you didn't know as well.
Okay. Thank you. Thank you. Thank you, Mr. Chair. Those are my questions.
Thank you, Council President.
Okay.
Good afternoon, Haywood.
Good morning.
Good morning, I should say. You're right. Good morning.
Good afternoon.
I know. You're always one step ahead of me.
Well, I said good evening earlier, so.
Before I ask a question, I do want to let my friend Haywood know that on the next docket, I would like to ask him to come up to the front and testify. So Haywood, we're going to ask if, after this docket in a few minutes, if you can come up and join us, if that's okay. I know you're not shy.
Want me to sit there?
Yeah, you can come on up now if you'd like. You can come on up now if you like.
I like that. Sorry about this. Okay.
So my question to Rob would be, under the Biden administration, Harris administration, the PACT Act, the most significant veteran legislation probably ever enacted, a lot of goodwill from that. A lot of veterans came forward and said, I want to get tested. I want to get services. I want support for my family. But now, Commissioner, the same veterans are saying that, I came forward to seek help, to seek services, but now is this the same VA that's also cutting the same programs that just 2 years ago you told me to come forward and seek the services? So do we have and not to put you on the spot, Commissioner, but is there a mixed message at times that we're telling veterans to come to the VA for medical care, for services that they've earned, and then a year later we're telling veterans, oh, by the way, some of these great programs that we talked about, we're going to have to cut the program because we're going to have to cut personnel. I have heard that at many of these veteran service organizations. Just wanted to ask your opinion as well.
I'm going to answer that question as a veteran. And my answer is, you're correct. Just a couple of years ago, for many years, we were told, if you're a veteran, the VA is there for you. The VA is there for you to take care of you, to take care of your services. You honored your contract with us. You as a veteran, you honored your contract. It's verified, you honored your contract with us. So now it's incumbent upon us as a community, as a nation, to honor our contract to you. And oh, by the way, our contract to you has no expiration date. But now you're telling us that, you know what, there may be an expiration date for certain services because we want to roll back the number of employees going back to, I don't know, 2001 or whatever year it is that they're talking about. So yes, you are correct. There is a mixed message that I'm getting as a veteran. There is a mixed message that I'm hearing from my fellow veterans as well about what's going on in the VA healthcare system. Who knows, today we get taken care of in one way, then tomorrow is going to change for us in another way. And that is the big concern that we veterans have, is like, we don't know the type of care we're going to get tomorrow. And what does that say about the future of our military as well? If we have young men and women who want to join our military, but then they see what's going on in the veterans community now and how our country are not taking care of us, what is that going to say for them and the possibility of them joining our forces? We have the best, most strongest armed forces in this world, and we have to maintain that. And one of the ways to maintain that is to honor the contract to our veterans who are veterans today and honor the contract of those who are going to be veterans in the future. So we do that by giving them the care that they earned and deserve through the VA healthcare system and also through VA Benefits Administration as well.
Thank you, Commissioner. I agree, and I also agree with. I also agree. We have a mixed message too for women veterans, where the VA has made remarkable progress. In my opinion, I can't speak for women veterans, but I think they have made remarkable progress, maybe in the last 10 years, on welcoming women veterans. But on the other hand, as we move forward and we're cutting programs and services for all veterans, certainly women veterans too, but when we're cutting services for veterans, it's a mixed message for women veterans that have already been shunned at a period of time in their life, maybe from the VA, maybe not, but maybe they didn't have a good experience previously. Now they're willing to give it a second chance, and here we are again trying to cut services again for veterans.
And if I may, Counselor,
Yeah.
if I could just add a little bit more to what I said. And when I'm referring to the VA and the services being cut and the number of staff being cut, I'm not referring to those that actually work at the VA healthcare system right now, because I could tell you those are some of the best people that we have taking care of our veterans right now. Those are some of the best, compassionate people that take care of us, and we need to rally behind them as well. Those that work at the VA right now, those that make it their duty, to ensure that our veterans are taken care of. So we have to rally behind them and ensure that they know that we are behind them. The city of Boston, the Commonwealth of Massachusetts, and this nation are behind them 100% to ensure that they're able to do what they're supposed to do in taking care of our veterans. I have a lot of friends. I've worked in the VA for many years before joining the city. So I have a lot of friends, a lot of people that I still keep in contact in the VA, and I could tell you that some of them aren't feeling very well. The morale is not where it needs to be. But yet, when you go into the VA, like I have, they put on that facade to let us know as veterans that, hey, I'm still here for you. I'm still here to carry out the mission. They have that smile, they have that empathy that they've always had in taking care of our veterans. So I want to let all of them know that, hey, we hear you, we're here for you, and we're going to rally, behind you, because we know it's not you. We know it's not those that are working in the VA healthcare system that are causing these cuts, that are causing the slashes in the healthcare of our veterans. But we want to let you know that we know that you're there to take care of us as veterans, and know and understand that we're behind you.
Well, thank you, Commissioner. Doctor, would you like to respond?
Yes, I would just like to add that I think it's really true that people who work at the VA, we are in a common mission. We share the mission to take care of veterans for the service and the sacrifices that they made for this country. And I think further, we have specific knowledge, especially about these things like military exposures and the health effects. That's something that not everybody, if a veteran goes outside the VA to the private sector, they may not be as familiar with, what are the different experiences and the effects of those exposures. So it's so vital that the VA be able to continue to provide these services that have been promised and that veterans deserve.
Thank you, Doctor, and thank you to the Commissioner. And like Rob, I get all of my medical care at the VA, mostly Jamaica Plain, but some in West Roxbury too. The medical care I receive there is excellent, and just want to acknowledge the professional medical team at the VA medical facilities for the work that they do. Before we go on to the next docket, I want to give an opportunity to my friend Haywood to speak, because Haywood, we respect you.
Yes, I just want to thank you
You're welcome.
for inviting me here and for the consistency that you show your concern about our veterans, you and the commissioner and, the city council with some tutoring. We're understanding the concern of the cutbacks and disfigurement, if you will, of the VA right now. One of the things that I see is the importance of understanding that the VA, when it comes to our veterans and minorities, it's not a one-stop, solution-driven institution. We have been underrepresented in terms of services and care, and slowly we are recognizing it through this kind of meeting and my conversations with the commissioner and the program that we have at BNN, where we talk about beyond the uniform, that reaches out to find out what the service quality is for our veterans in our community. And I'm not surprised that a so-called commander-in-chief who's not a veteran himself would be indifferent to the work that's going on by one that's not even born in this country, never served, never raised his hands as we did to serve our community. It will pass. It will pass. What I think we need to do is to understand that veterans are an overlooked and underused community resource. And I say it all the time that we need to be more involved in veterans affairs as well as community affairs. Had we been more educated, we would not be where we are today about the contribution that veterans have made. And I just want to get that in. Thank you.
Thank you, Haywood. It's an important point that you made, so we're honored to have you here. We're going to go on to the final docket, and Haywood, I know this is an issue that you've worked on, but certainly Doctor has also done tremendous work on it. But the next docket we're going to be speaking on is docket 0320. It's an order for a hearing to discuss the lung cancer rates among Black veterans. As I mentioned in my opening statement, I had the opportunity last week to go to the Kroc Center, Salvation Army in Roxbury in the Dudley area, Nubian Square. And there was an informative discussion there with veterans, with military families discussing this specific issue. I'm going to ask Dr. Weiner to kind of open the discussion on what you think is most important on this issue, and then I'm going to go to my colleagues for questions. But I also want to hear Haywood's opinion and Rob's opinion as well. So I'll play it by ear. But Doctor, you're up.
Okay. So thank you so much for bringing this docket to the hearing, because lung cancer is a critical health issue facing veterans. 8,000 veterans are diagnosed with lung cancer each year. Just take a moment to think about that. 8,000 veterans every year. It's a lot of fathers and sons and mothers and daughters who are affected by this disease. Veterans have higher rates of lung cancer than others in the U.S. population, and that's due both to higher rates of smoking, and it's important to note that cigarettes were distributed in military rations through 1976, but also due to the toxic exposures that we've discussed that veterans face during their military service, such as Agent Orange, burn pits, and asbestos, among others. Lung cancer is far and away the leading cause of cancer death among veterans. 5,000 veterans die each year from lung cancer, and that translates into an average of 15 veterans every day dying from lung cancer. Black men have the highest rates of developing and dying of lung cancer of any demographic group in the United States population, and Black veterans are at especially high risk. Unfortunately, lung cancer survival is lower among Black veterans. And this is due to a lot of factors. Black veterans are less likely to receive the treatments that have been shown to be most effective at curing lung cancer, and they also experience delays in getting care at every step of the pathway from diagnosis through treatment of lung cancer. And this is especially true for veterans who receive their health care outside of the VA system. And timely diagnosis and treatment is crucial. Early detection through lung cancer screening, followed by timely treatment, can prevent many of these lung cancer deaths and represents our best hope to improve outcomes for veterans who might not otherwise receive the care that they deserve. Screening for lung cancer by getting a CAT scan of the chest every year, a quick, easy, painless test, takes just a few minutes. But doing that every year can reduce the risk of dying of lung cancer by 20% among high-risk people. And studies actually show that the benefit of screening is even greater among Black people. Lung cancer screening is recommended in guidelines issued by the United States Preventive Services Task Force for people who are between the ages of 50 to 80 years old and who have a significant history of cigarette smoking. And importantly, whether you get it through the VA or somewhere else, lung cancer screening is covered by insurance and is free of out-of-pocket costs for people who meet these eligibility criteria. The Veterans Health Administration has been a leader in lung cancer screening nationally, and veterans who receive their care through VA are more likely than people receiving care outside the VA to have their cancer diagnosed at an early stage when it has the best chance of cure. And here in Boston, the VA Boston healthcare system has a robust lung cancer screening program that's one of the most active in the country. But many people who are eligible for lung cancer screening, including both veterans and non-veterans alike, have never heard of lung cancer screening, and they don't realize that they qualify for this potentially life-saving test. In fact, fewer than 20% of eligible Americans have been screened for lung cancer, and Black people are even less likely to have been screened than other Americans, often because they're not aware of screening or how to access it. Our team at VA Boston and at Choir is working to change that. In the Vet Peer Connect study that I lead, we partnered with Black veterans, including Haywood Fennell, from around the country, and with community organizations that serve Black veterans, like NABVETS, the National Association for Black Veterans, and the Triad Veterans League. And together we developed a community outreach program designed by Black veterans for Black veterans, with a goal of raising awareness about lung cancer and lung cancer screening and helping eligible Black veterans get screened. We've been holding community events, such as the one you mentioned at the Kroc Center, all around the city, trying to reach veterans where they are, rather than expecting them to come to us to find out about screening and other services through the VA. And we've worked with partners such as Commander Meredith Tuitt of the William E. Carter American Legion Post, Commander Grady Durden of the VFW Post 1018, and Catherine King of Harvard Street Neighborhood Health Center. We've heard positive feedback from the veterans who have attended our events, including several who've taken action to get screened as a result. And what's more, these events have also served to build connections and trust between the community and the VA. We've heard veterans say that they could tell that we were really listening to their concerns and that they're going to give the VA another chance after attending our events. And as our veteran peer, Sergeant Stephen Abrams, always says, that's what it's all about, raising awareness and improving health for one veteran at a time. I can't think of a more important goal than getting veterans of color the screening and health care that they earned and deserve for the service and sacrifice that they gave to this country. On behalf of our entire team, I want to acknowledge and thank the many veterans, community partners, and VA staff who've helped make this program a success. We've also very much appreciated the support and recognition we've received from both the Commonwealth and also from Commissioner Santiago and the Office of Veterans Services, including the award that my mentee, Dr. Lauren Carney, received last night at the Women Veterans Roundtable for the amazing work that she's contributed to this study. And most importantly, I want to thank the men and women veterans who inspire our team every day. We are going to keep on fighting alongside you to make sure that all veterans have access to the life-saving health care like lung cancer screening that they've earned and deserved. Thank you.
Thank you, Doctor. That information was very helpful. Thank you for what you're doing. Rob, would you like to go into a opening kind of statement about this specific subject?
I think the work the choir is doing is utterly important. I've been to a couple of their events, and it's just life-saving information that they have to put out there. And I love their approach of actually going into the community. The William E. Carter Post 1018, they attended our event, our Black Veterans Luncheon event last month here at City Hall. So they want to get the word out there to let the veterans know that this is utterly important and could be life-saving for them.
Thank you, Rob. Haywood, on black veterans and lung testing, lung screening, lung cancer rates, do you want to weigh in on that issue?
Oh, I'd like to weigh in on that.
You would.
With the understanding that veterans are weapons. We fight for freedom for other countries and die and come back with our eyes all foggy with memories that we cannot talk with our families, and have to try to negotiate our way to be recognized that we need help. And so in that regard, a few years ago, the late Dr. Joseph Warren, who was on the staff at Northeastern University, Triad Veterans, and Ron Armstead and I were able to get a grant of $10,000 from the Boston Public Health Commission, and we did a limited survey on the need for more sensitivity when serving African American veterans. And we found that in the finding that, veterans don't trust the care and services rendered at the VA based on the fact that there's a lack of cultural sensitivity and the systemic racism that has been a part of the United States military and, slowly wearing down. And so with that in mind, we approached the then Secretary of Veterans Affairs for the Commonwealth of Massachusetts, and they weren't interested in hearing that because when you're ugly, nobody, wants to call you ugly, be known as doing ugly things. And ignoring our veterans brings into the fact that there's a cost analysis when veterans don't go to the VA as they deserve, and they go into our community and take up spaces in community health providing places denying that they're veterans. And that takes the place for somebody else from the community to get those services. A lot of other veterans will involve themselves in treating themselves and become addicts, be it alcohol or some other kind of illegal substance. And that's another issue that you have to deal with before we can get them to understand that we have to be more responsible in getting the treatment by being able to demand and stand together. You have a lot of veterans, like you say, you go to the VA to get your care. I go to the VA to get my care. But a lot of veterans don't go to the VA. They're in better position emotionally and financially, and they forget about the veteran that's out there. You go out and you do these census on homeless veterans, but a lot of people that are veterans will stay away. You'll never know who they are. So that's where we come in and try to talk to them and refer them out to services like Whittier Street, like up on Blue Hill Avenue and Harvard Street where Ms. King is located, and make ourselves available for the cancer research that's being done in our community. They coming into our community because they know that veterans are not going into the VA hospital. There are a lot of veterans that are doing this. And so what we try to do through our television and radio program is make announcements on issues and call his name to go to his office. I do that deliberately because we need to know where the help is. We need help. We're looking at mass and cash. If you go into mass and cash, I'm sure you will find significant amount of veterans, male and female, that's out there homeless. So we're looking at strategies now that are solution-driven. Thank you.
Thank you, Haywood, and every time you come here, Haywood, you have excellent recommendations, excellent points, and we respect you and we respect your military service, and probably even more important, we respect that you're always advocating for veterans in
Right.
trying to help them the best you can. So thank you,
Exactly.
Haywood.
Thank you.
I have questions, but I'm going to ask the City Council President, Councilor Louis Jean, if you'd like to go first.
Thank you, Councilor Flynn, and I want to just again thank you to this panel. I learned quite a bit, even if the information is sobering. Thank you, of course, to Haywood for all of your advocacy, everything you do, Triad Veterans, everything that you do for veterans, specifically Black veterans, and for the way in which you teach us how to be of better service to those who have sacrificed so much for this country. Doctor, you said that veterans who seek care outside of the VA are less likely to be screened for lung cancer or to be diagnosed with lung cancer, to get, have worse health outcomes as a result. So, and I'm trying to make sense of that. And I understand, like, if we take the VA as a system or as an institution, in the way that anything is a system or institution, veterans, particularly Black veterans, have had negative experiences with the VA or difficulty getting into the VA, which is why they turn away from the VA or don't seek services, right? If there are additional reasons, please let me know, because I really do want to understand that. But they're going away and they're going to other places that have comparatively inferior care.
Correct.
That seems like a quagmire, like a big problem. And I don't know, is it discrimination that Black veterans are facing when they try to encounter, when they go to the VA? Is it the paperwork? Like, what is happening that is turning people away from an institution, a system that could provide them with superior care to where they end up going?
Mm-hmm. I think there are multiple factors at play, and a lot of this I've also learned from discussions with Haywood. But I think there's a lack of trust because of the way that veterans were treated when they first came back from their service many years ago, and a legacy of mistrust. The VA has worked so hard to change that. And I do think that the VA of today is different than it was in the past, but many veterans don't know that, and they don't know about the services that VA has, and they don't know some of those statistics and facts that I mentioned and that you repeated, that care and outcomes is actually better for lung cancer and all those points that you mentioned in the VA as compared to outside of the VA. Many veterans don't know that. That's why we're trying to get the word out. And as Haywood very eloquently said a couple of years ago, when we first started cooking up this study together, sometimes the VA expects veterans to come to the castle, and we don't come out to the people. The VA doesn't, but that's what we're trying to change with these community events, to get the word out, coming on to Haywood's show, and trying to spread the word and encourage veterans to come to the VA to get the care and treatment that they have earned and deserve.
And so, just an additional question, and I hope Commissioner Santiago Haywood, if you want to answer the last one, please do too. But they're connected. Where are veterans, particularly Black veterans, seeking care if they aren't seeking care at the VA? Is it at their community health centers? Is it at, the Kearney is a hospital that just closed and has ripple effects on vulnerable communities. I'm imagining maybe one of those communities may also be the veterans community. I'm just trying to think of, like, where are they, Haywood also mentioned that a lot of folks are self-medicating. So just where is there data to show where people are going if they're not getting their care at the VA?
For me, I don't have any data as to where they're going, but I know that there are a lot of community health centers that are trying to pick up the slack as best as they can. But going to the doctor's point is these community health centers don't have the background or don't have the information with regards to our veterans and why they may have lung cancer, for that matter, what caused the lung cancer, because for a lot of them it's not smoking, is because of the conditions that they were in while they were in service.
Thank
Let
you.
me say something.
Yeah, go ahead.
I just want to say something, to your point regarding the question. Public service announcements are good, but we have to be able to convince the veteran through public service announcements, that they can hear, not just on the holidays, but every day, about the importance of the services that they have given our country and that, we respect that. I have a calendar project. I've been doing it for 10 years. And it was created to give black veterans a presence for their service to the nation. And two people on there are the 54th, the statue, and also one other, I can't recall his name now, blame it on age. But we are working with a petition to sign so that we can present it to the United States Postal Service for consideration for a United States commemorated stamp series. Along with that, I want to thank the Commissioner for being a part of the Edward O. Gordine Statue Committee, and I was the chairman when they unveiled the statue in Roxbury for kids to see and know the presence of African American veterans and their contribution to our country. And so I think that we need to have a strategy of public service announcements, bulletins, events, to raise the consciousness of the veteran that are not partaking in helping heal this process. The commissioner's office, this meeting, the president, and the doctor, you know me. I'm going to always talk about the conditions of veterans and how do we improve that. And I think that we want to have our veterans understand that we care, but they must share beyond the uniform because, like I said earlier, the veterans are an overlooked and underused community resource. We have a theater program, and 6 of our volunteer people on our strategic planning group are veterans. Our veterans reading brigade are veterans, and you don't have to be a veteran to support veterans. And you could say that in the PSA. We're concerned about your health. Come see us, or we'll come and see you. I did a thing when I was working with Multicultural AIDS in the collaboration posture for HIV/AIDS. I understand that we can have a voice in community development and helping our veterans at the same time. So it has to do with how we market what you say, how we market this day here. Now, when I go back home, I don't know what time I'm going to write about me being here. People tell me about writing emails at 3 o'clock in the morning. Well, I'm sorry. If that's when I'm feeling it, that's when I'm writing. So.
Thank you. Send them whenever you want, Haywood.
I got one this morning.
Thank you.
Thank you, Haywood. Thank you, Mr. Chair. I don't have any further questions, but just want to again reiterate how grateful I am for your individual service to the city and the many ways in which you teach us every day about the issues for us to put pen to paper and figure out how we allocate resources to address these issues. So thank you.
Thank you, Madam Chair. Before I continue, I did get a message. Councilor Murphy is away at her son's U.S. Army Airborne graduation. I'd like to recognize her, the Vice Chair of the City Council Committee on Veterans, Military Families. That ceremony is at Fort Benning. obviously attending her son's graduation. So we want to thank her son and her family for their service. Let me ask a couple of questions, and then we'll go to public testimony if there is any public testimony. And I was thinking of this issue, not necessarily this question, but I always advocated for, when I speak about and learn about women veterans, it's critical to have a VA that also has many women that work there in the various fields, medical fields. I think it's important for women to have women medical providers as well, that can talk with them and communicate and understand many of their concerns and challenges. But on the other hand, and maybe I want to forward this question to Haywood. I never really thought, and I should have, but I'll be honest with you, I never really thought, do we have enough African American veterans working in the VA medical facilities that can help returning African American veterans patients, that we can be more welcoming with staff that's also African American medical providers as well. Just wanted to get your thoughts on that issue, Haywood. Yes, sir.
I just want to respond to that question and acknowledge Commissioner Santiago and his interfacing with the federal government, and particularly the people over at the VA, because he's told me several times about having meetings with those people. And I think it's very important that we continue talking to them and educate them on the importance of employing people of African American descent to deal with these people, because sensitivity is very important. You know, we don't want to waive a person have predispositions about their situation without having people that can articulate with the person that's seeking the services that they need. So, you know, I just want to say that his meeting with the VA is very important. I did a program over there, and you know, I do my assessment sometimes just walking around and looking at things. And also, I received services over there when I was in the detox about 30 years ago.
Right.
And I saw one lady, one female, okay, to your point, working in mental health services. And we need more females there, African American female women, and we don't have them. We have them in other less professional, like registering people and stuff like that. So we may need to go to the schools and talk to the schools about getting some interns there to finish up their degree, you know, that's sensitive to what we need to do to improve the services, etc.
Well, thank you, Haywood. That comment was excellent. Let me ask the doctor and Rob, and doctor, how can we recruit more African American veterans or African American medical providers to work at the VA?
That is a super important question. I don't have the answers, but I think one thing that is important is, you know, it is important to have representation. And for example, when we were planning our study and we were talking to African American veterans all over the country, like Haywood, we heard that it was important at these community events to involve a healthcare provider of color. And we're so fortunate to have Dr. Fatima Wilder, who is a thoracic surgeon, a doctor who treats lung cancer, and who works at VA Boston healthcare system. She is a part of our study team, and she's a participant in all of our community events. And, you know, there's a part of the event where she and Sergeant Stephen Abrams, our veteran peer, role model what a conversation about lung cancer and lung cancer screening should look like between a veteran and their doctor. And that's been something we've gotten so much positive feedback from the community about, having somebody who looks like them and who is providing culturally sensitive care. I think it's so important.
Thank you, Doctor. And maybe to Commissioner Santiago, I know it's really not necessarily the City of Boston's responsibility, but are there, just want to ask a general question, are there any programs that you're aware of that kind of recruit people coming out of these great colleges, universities, hospitals, letting them know about the programs, employment programs at the VA, especially trying to recruit people of color? Do we know if that's happening?
That's a great question, Mr. Chair. I do not know of any specific programs. I do know that there are a lot of events where USA Jobs go to. I know there's a recruit military initiative as well to try to recruit service members into positions within the federal government, to include the VA. I will tell you, since we're talking about it, I believe it's about 30% of those employed by the VA are veterans. Mm-hmm. And I think is of utmost importance to the doctor's point and to Haywood's point that representation must play a role in that. When you apply for a job through USA Jobs, whether it's for the VA, the EPA, or any other federal government job, there is a question on there is if you are a veteran. And you could either get a 5-point preference or a 10-point preference, up to, I believe, is a 15-point preference, depending if you have a disability rating. So the government, the federal government, knows that it's important to hire our veterans in these positions, in particular within the VA healthcare system, which is still, going back to our earlier conversation, appalling to me. That the VA is considering cutting jobs within the VA, as that also affects, our veterans. But I think it is important that when veterans do go into these facilities, that they do see somebody that's representative of who they are as well, and that needs to be very important and high in the recruiting process and also in the hiring process, that those that are taking care of our veterans are representative of the veterans community, which, as we all know and we've spoken of today, women are the biggest growing demographic within the veterans population as well.
I just want to say one thing.
You say what?
What the commissioner was saying, right? And we have an opportunity here because of our location and because of the work that's being done for our veterans, modeling a program, creating a model program that can be replicated across the country, because we're not just the only ones that's dealing with this situation, and we are here with these institutions that can provide us the infrastructure for academic development with a curriculum that will address the need to have more women, professional women involved. Harvard Institute, BU, they have medical schools and stuff like that. And so hopefully we could put together many meetings and take a role in helping to educate them to create a curriculum that we could use to recruit other medical people so that we can be problem solving, in this effort. They have, I look at the hospitals sometimes and I see people and I say, well, what do you do? And they tell me what they do. And then I tell them I'm a veteran, and they don't know anything about veterans. They don't know anything about veterans and the sensitivity that's needed when you treat them. And so I think that it would be good if we could, down the line, come back, or Commissioner, you could set up something and we could further discuss how do we create the model. I know you're busy and everything, and we'll be able to create and distribute the responsibility by involving the people from the hospitals.
Well,
I'm
that-
just,
That's a great suggestion. Thank you, Haywood. Just as a brief response, what I'd like to do, I'd like to have a city council hearing, a formal city council hearing like this, gear it towards more of a listening session for veterans. I'd like to have it at the bowling building, which is in the heart of Roxbury.
save me on parking, thank you.
Yep. And that's where Haywood and I go for coffee, right at that place there. Haywood likes to go for coffee with me because I'm always buying it, you know.
You up so fast. I catch up.
But maybe we'll do that sometime in the summer, and certainly would, Commissioner Santiago, I would love to have you involved in the VA medical team as well, Doctor. So I'll keep you contacted. My final question, Doctor, and it's not obviously about lung cancer, but the high rate, and I don't mean to put you on the spot, and Commissioner Santiago, maybe you can answer it too. The high rate of prostate cancer for African Americans across the country, and high rates of prostate cancer for African American veterans as well. What is the VA doing specifically on reaching African American veterans on this very important subject? Do you have any background information on that, and any message that we could also relay to some African American veterans as well?
This is not my area, but I can comment on one active effort that I know is going on. VA has invested a lot in our precision oncology program, and there are these polygenic risk scores that you can use to predict somebody's risk of developing things like prostate cancer, lung cancer. And I know that one of my colleagues, Dr. Jason Bassi and Dr. Marla Clayman at the Bedford VA, are working on a project that is specifically about the use of polygenic risk scores to reach African American veterans who may be at heightened risk for prostate cancer, and doing the same kind of thing where we're listening to the voices of veterans to understand what their needs are, what their preferences are of how these tests are used, how their doctors are talking to them about whether or not to get tested, what the next steps would be depending on the results, and to make sure that that communication happens in a culturally sensitive and understandable manner. And I think this is just an example of the type of research, listening to the veterans' voices and then using that to tailor the care that's delivered, where that's something that Choir does a lot of research in that area, and I think it's really important to be able to, as Haywood so eloquently said, the culturally sensitive care is so important.
Thank you, Doctor. Commissioner Santiago?
I have nothing to add to that, but that's a definite conversation that we could continue and report back to the council.
Well, thank you. I'm going to go directly to public testimony if we have any. Okay. We don't have any public testimony, but I would welcome the public to still testify if you'd like by email. And I'll make sure that the testimony that you provide gets to every city councilor. I'm going to ask, I'm not going to give a closing statement. I'm going to ask my the three panelists if they'd like to give a closing statement. But Council President, would you like to give a closing statement?
I just want to say thank you, Council Flynn, for holding this hearing, and I want to thank you for, again, educating us. I want to thank, it's sometimes a tragedy to think about in all of these spaces. There's a lot of discrimination, there's a lot of mistrust, and there's a lot of work that we have to do to overcome that. And each of you, Haywood representing community advocacy, commissioner representing an institution here in the city of Boston that is doing everything it can to try to bridge the gap. As a new doctor, for the research and work that you're committing to doing is all how we get to filling, to trying to build that trust back. So just thank you.
Thank you, Council President. I'm going to give each of you an opportunity to give a closing statement, and I would ask if you could provide some contact information, if any veteran that wants to access services, if you want to provide a general number or email or homepage, if you could also do that in your final closing statement. But let me go to Dr. Weiner. Dr. Weiner, would you like to give a closing statement? And thank you for being with us.
Thank you. Thank you for the opportunity to be here today and for holding this hearing. I just want to reiterate that the VA is here for veterans. We want people to know that they have access to these services, lung cancer screening, as I spoke about, but many other healthcare services that are tailored to veterans' needs, attentive to the types of exposures and experiences that veterans have had in military service, and that the care quality and outcomes in the VA system, multiple studies have shown, are equal or better to those outside of the VA. So I think that's something a lot of veterans don't know, and I just want to spread the word on that and to say that we are committed to providing veterans with the care that they have earned and deserve.
Thank you, Doctor. Commissioner Santiago.
Before I say my final remarks, I did want to say one thing to touch on a quick little point from Haywood that he said earlier about having the community engage in the process and taking care of our veterans. Just want to reiterate that you don't have to be a veteran to come to any events that are about veterans. You don't have to be a veteran to come to any and be a part of and participate in any programs that are for veterans. So if there's anything that we're doing in the city of Boston that pertains to veterans, it's welcoming to everybody. Everybody could come and participate in it. Everybody could come and listen, even if they just want, like last time, again, we had the women's roundtable discussion, great conversation that was had by all. That's, just a great example of how somebody could, participate. So again, you don't have to be a veteran to participate in any veterans events here in the city of Boston. I also want to say I'm very optimistic. With the course that we're taking here in the city of Boston, with the engagement from the city council and also from our mayor. I know Mayor Wu, when she had her congressional hearing a couple of weeks ago, she was the only mayor that mentioned veterans at all in her comments, and I was very proud to have heard her not only defend our city and our neighbors, but also to mention veterans in her remarks as well. City of Boston, with all our partners, we are steadfast in our obligation to continue supporting and caring for our veterans and ensuring that they are valued and respected. We're going to continue to work with organizations and with fellow veterans like Haywood to provide benefits and services that we all as veterans have rightfully earned and deserve. So if there's anybody out there who would like to contact us, the contact information for our office, you could via email to veterans@boston.gov. You could call us at 617-635-3026. That's our main line to contact our office. If you have any questions about veteran services, you have any questions about VA claims, about the PACT Act, about the HERO Act, or anything dealing with veterans, we strive to be a one-stop shop for all your care and all your needs and resources to our veterans and their families.
Thank you, Commissioner. Haywood, would you like to give a closing statement?
Closing?
Yeah, we want to say thank you.
Oh, he's only started.
Yeah.
Closing is an opening for me.
Well, we welcome your comments.
I just want to, first of all, thank you again for having this meeting, and also for the good doctor in the choir project, and my involvement in that has been, it's been an awakening on the importance of coming into the community. Now, I remember doing a thing over there at the VA hospital on HIV, AIDS education, and It was okay, but the thing is that we have to go into the community to find the veterans. And that's what the commissioner is talking about. You know, call us anytime. That's a PSA. We need to be talking to BNN, you know, the general manager, and seeing how we can format something where we can create some PSAs, you know, that we organize. You know what I mean? When is the next cancer stop? Now, they were there of Saturday, but we had a production at the Strand Saturday. Otherwise, I would have been there. You know, because that is important that our veterans know. And finally, we should consider talking with the Black Ministerial Alliance, because people are sitting up in the church, and some are veterans, or some have veterans that family members that might still be serving. Why not consider having an event, a gospel event, you know, with music and everything during the summer months, and have our tables of information there to educate and involve them in the process of helping us raise the presence of veterans. Thank you.
Thank you, Haywood. Honored to be with you and to be with the doctor and the commissioner. Also want to acknowledge.
My pleasure.
Thank you, sir. I also want to acknowledge the Deputy Commissioner Estrada for being here as well. Our friend, Commander Tewitt from the Carter Post. I know she wanted to be here. She was testifying last night at the Women's Roundtable discussion. She did an outstanding job. I'm also a proud member of the Carter Post as well, on Blue Hill Avenue.
Yes.
Yep. So at this time, these dockets, 0166, 0255, 0320. This hearing is adjourned.